Toothpaste is an essential part of oral hygiene for people of all ages. It helps to clean teeth and freshen breath while also protecting against tooth decay and gum disease. However, as we age, our oral health needs change, and the consequences of using toothpaste can become more severe. In this video, you will discover 5 potential consequences of using toothpaste after the age of 50. Abrasion of tooth enamel. Toothpaste typically contains abrasive ingredients that help remove plaque and stains from the teeth. However, as we get older, our tooth enamel becomes thinner, making it more susceptible to damage from abrasives. Using toothpaste with a high level of abrasiveness can wear down the enamel, leading to tooth sensitivity and even cavities. To avoid this consequence, it is essential to choose a toothpaste with a low level of abrasiveness. Look for toothpaste that is specifically designed for sensitive teeth, or that has the American Dental Association seal of acceptance, which means it has been tested and found to be safe and effective. Dry mouth. As we age, our bodies produce less saliva, which can lead to dry mouth. Dry mouth is a condition in which the mouth feels dry and sticky, and it can be caused by medication, radiation therapy, or other factors. Using toothpaste that contains harsh chemicals or alcohol can further exacerbate this problem by drying out the mouth and causing irritation. To avoid this consequence, it is important to choose toothpaste that is specifically formulated for dry mouth and contains gentle, hydrating ingredients. It is also recommended to drink plenty of water and avoid caffeine and alcohol, which can further dehydrate the body. If the video is being useful to you, subscribe to the channel, activate the notification bell and click on like. Gum irritation. Gum recession is a common problem among older adults, and it occurs when the gum tissue around teeth pulls back, exposing more of the tooth's root. This can lead to sensitivity, pain, and an increased risk of decay. While toothpaste is not directly responsible for gum recession, it can exacerbate the problem by causing further irritation and damage to already weakened gum tissue. To reduce the risk of gum recession, it is important to choose toothpaste that is gentle on the gums and avoid brushing too hard. It is also recommended to use dental floss or interdental brushes to clean between teeth and below the gum line. Fluoride toxicity. Fluoride is a mineral that is commonly added to toothpaste and water to prevent cavities. While fluoride is generally considered safe, excessive consumption can lead to fluoride toxicity, which can cause a variety of symptoms, including nausea, vomiting, and seizures. Older adults are at a higher risk of fluoride toxicity due to their reduced kidney function, which can impair the body's ability to excrete fluoride. To prevent fluoride toxicity, it is important to use toothpaste in moderation and avoid swallowing it. It is also recommended to use fluoride-free toothpaste if you have kidney problems or are at risk of fluoride toxicity. Interaction with medications. Many older adults take medications that can interact with toothpaste ingredients, leading to adverse effects. For example, blood-thinning medications can interact with toothpaste containing aspirin, leading to increased bleeding and bruising. To avoid this consequence, it is essential to speak with your healthcare provider and dentist about any medications you are taking and any potential interactions with toothpaste ingredients. Additionally, consider using toothpaste that is free of harsh chemicals and specifically formulated for sensitive teeth and gums. Although toothpaste is generally considered safe for all age groups, using it after the age of 50 can have potential consequences. To prevent these consequences, it is crucial to choose toothpaste that is specifically designed for sensitive teeth and gums, devoid of harsh chemicals, and low in abrasiveness. It is also important to maintain good oral hygiene practices, such as brushing twice a day, flossing daily, and seeing the dentist regularly. By taking care of your teeth and gums, you can sustain a healthy smile and ensure good oral health throughout your life. I hope you liked it and click on the like button, subscribe to the channel, turn on the notification bell, and don't forget to share the video with your friends and family.